Hi there. Good morning, good afternoon. And thank you guys all for joining. We're going to give folks a couple more minutes to join us. But if you're here ready, then just pop into the chat where you're joining from. Would love to see where everyone is joining us from today. I'm personally in Brooklyn, New York, and enjoying a pretty sunny day, although very, very cold here. Very much ready for the spring and summer to finally hit. Great. Thank you, Jessica from Tampa. I bet you're getting warmer weather. And as we go, just a couple of housekeeping before I jump in as people are kind of streaming in. If you have any questions, you should have access to a Q&A. We'll be sharing out some links sort of now and then in the chat. So definitely use those for resources. And then at the end, we'll be sharing some of my contact information so that you can reach out if you have any additional questions. But I'll be leaving time at the end for any questions that we want to answer during the session. Awesome. So it looks like we have a sizable mass. So I'm gonna jump into the content and get us started. So as you may know, we're starting this series of an intro to Fitwel from sort of a variety of different perspectives, sharing the unique team members that sort of head up the Fitwel team. And I am Sarah Carrera. I'm the managing director of Center for Active Design. So I'm coming with my background in public health and communications. I really focus on the translation of the evidence base into the strategies that are within the standard on one side of things, and then on the other side of things, managing the certification process. So ensuring that that process upholds the standard, maintains the rigor that we work so hard to uphold. So today I am going to be diving in a little bit about starting with who we are, how do we get here, why are we focused on the intersection between public health and the built environment, what that means, giving a little bit about the business case for health. This is an area that we have sort of consistently been focused on. What is the economic value that's really tied to health promotion within the built environment? We see a really strong economic argument for making these improvements across the real estate sector. Diving into some details about the Fitwel standard, and then sharing a little bit about different pathways, different scorecards. We offer solutions for a variety of different contexts, so really clarifying what those are and what they look like to help you sort of navigate the standard as a whole. Spotlighting some industry leaders and sharing some different ways to get involved with Fitwel. We offer many different pathways for different types of companies, and then close out with some questions and next steps to kind of stay involved with us over in the future. So just to start with a little bit about who we are and how we come to this kind of area, what our perspective is. I joined from Center for Active Design, and we're a nonprofit that is the operator of Fitwel. And we really have a vision for a healthier future where every building and community is infused with health promotion. It's enhanced to support human health and well-being. We see the real estate sector really playing a valuable role when it comes to promoting health in a variety of different ways. And the organization of Center for Active Design really comes from a public health background. So this intersection between health and the built environment is something that we've seen for centuries, and really since the beginning of time. We know that our environment and where we exist, live, work, study, play, all of those aspects are really, really play a pivotal role in determining the health and well-being of our population. And this is something that has been studied and implemented on for over the past several centuries. And in New York City, this really came to light during industrialization. We saw that during that period, there were a lot of health issues caused by industrialization. So with that kind of in reaction to those issues, spread of infectious disease, cholera, and many different illnesses, this was an area that policy began to step in and see, okay, how can we regulate our environment to really ensure that the spaces and places that folks are inhabiting, living, working in are really designed and optimized to reduce the spread of illness. So since then, we've really expanded our perspective on what it means to be healthy, expanded it beyond just preventing illness to ensuring that everyone has the ability to sort of lead the highest quality of life as possible, and expanded that definition of health. And in 2010 in New York City, Mayor Bloomberg was really focused on how can we create a city that promotes the highest quality of living possible, and also as a tool to attract world-class talent into the city. Obviously, New York is a place of lots of employers here who want to bring in talent. So really working together with the private sector to promote that perspective. And so since then, we have continued to expand upon how we think about health. In 2010, when the active design guidelines came out, which was really sort of the foundation of what Center for Active Design is built on, was really focused on physical activity. How do we promote physical activity and access to healthy foods? Since then, we've really expanded into other areas of health. So how can our environment promote mental health? How can our environment promote community well-being and social interaction and fight social isolation? So this has continued to evolve over the past couple of decades to where we are today. And where Fitwel comes in is Fitwel is really the tool that we use at the Center for Active Design to promote health and well-being, and really work with the real estate sector to provide the tools necessary to know how we can address health within our buildings and within our spaces. I come from the organization Center for Active Design, and we work closely with a day, which is the for-profit entity, which also co-operates the Fitwel standard. Center for Active Design is really focused on the research side of things, maintaining the standard, the content within the standard, while a day is really focused on bringing that to market and working with our clients and users to ensure that the solution is meeting their needs and really tailoring that solution in a way that that meets sort of the problems that you guys or the concerns that you all have and are working to address. And so to dive a little bit into this conversation around the value of healthy buildings, which we know is a really important consideration in determining how you want to address health within your spaces. What are your occupants demanding? Where are the opportunities? Want to provide sort of an overarching look of where we see that value and where we see that intersection. So we see the value from a couple of different perspectives. On one side, we see the demand from occupants. I think that in response to COVID-19, we have a much more informed tenant base. We see people asking questions about indoor air quality. We see people asking questions about what amenities are there to support their interaction with one another and socialization. And then on the other side, we see an increased interest in health promoting attributes of buildings from an investor perspective. So as you see here, when we're thinking about employees, 75% of employees now expect workplaces to support health and well-being, while within residential spaces, we see 71% of residents really placing value on those health and well-being attributes. And then from investors, and this was a survey that we conducted with the UN and Bentall Green Oak, we're really seeing that investors are really clued in to what are the attributes of a building that are designed to promote health, and see that as a real way to differentiate an asset in the market. And we have really been focused in the past several years on exploring this connection in a deeper way. What exactly is it about health promoting buildings or a Fitwel certified building that is leading or contributing to increased value? And what we found is that in conducting a study with one of our users, Quadrille, has a vast portfolio looking at sort of multifamily residential, workplace, and also industrial. We saw that there was a real connection between certain attributes and economic outcomes. So we found that attributes that we might not expect to drive value really were. So we went into this sort of thinking, okay, amenities are going to rise to the top. That's what our users are always really focused on and talking about in their marketing materials. What we found was actually that operations were the attributes that were having the greatest impact when it came to net promoter score. So the likelihood that a occupant was going to recommend the space to a peer or to a colleague. And that was really kind of a really interesting finding, because most buildings can do something when it comes to operational policy. So these are things like indoor air quality policy or a green purchasing policy or integrated pest management. So not always sort of the most marketable of attributes, but ones that we're seeing occupants really hone in on. People want to be in a clean space. People want to be in a space that feels good. And this is sort of one way in which our spaces can be managed to promote that. And so with Fitwel, we're really working a lot of times with existing buildings. We want this to be an accessible standard, a standard that can reach a wide array of buildings, because we really see an opportunity for all buildings to do something when it comes to promoting health and improving the health of their occupants. And the other kind of core findings that were interesting and sort of drove home some things that we were already aware of. One was around location. Location was tied to rental rates. This is something that we've seen repeatedly. And the other was healthy food access. So healthy food access is something that we really do see as a market differentiator, because it's something that not a lot of buildings are really focused on or doing, but it's a way that can really increase the value and increase the tenant satisfaction that we're seeing within the market. And when it comes to sort of looking at the broader picture of why certification, why kind of not only do the attributes or implement sort of the interventions, but also promote and kind of go the extra mile and get certified, we're seeing that in a study that was conducted by MIT, we saw that compared to non-certified buildings, those that were certified with a healthy building standard were 4.4 to 7.7%. They had 4.4 to 7.7% higher rent premium. So we're seeing a real impact when it comes to the bottom line, connecting to that overarching holistic view of health and well-being within the building. And so with that in mind, we really, I want to dive a little bit into the Fitwel standard and how that is a tool that can be used to guide users and guide you all through how exactly to get started when it comes to integrating health into your practice, into your work. And so one kind of area that I want to talk about is what sets Fitwel apart within the marketplace. So we at Fitwel are really, really focused on what are the kind of challenges that you all face in your day-to-day, and how can we address them using our platform and using our standard. And so in thinking about trying to create a standard that is straightforward, credible, can be applied at scale, and is cost effective, that's really what we're coming to you all with today. So I'm going to walk through a couple of different ways in which we meet those different challenges, and hopefully answer some of your questions along the way. So Fitwel, really, one of the areas that we really focus on is the relationship building that we have with our users. We are really committed to listening, to hearing, to understanding where your challenges are and working to meet them, while also providing information and guidance to integrate health promotion into your everyday. We think that whether you're a facility manager, whether you're an investor, a developer, owner, there's a role to play in integrating health into the work that you're doing. So whether it's creating an indoor air quality policy, or it's designing the building in a way that encourages stair use. There's such a wide array of ways in which health can really be integrated. So we're going to talk about a couple of different ways that we work with our users to do that. And so as you can see, we really do have a global impact. We are represented in more than 60 countries. And one thing I'll note too is that from the evidence side or the research side, we look at an evidence base that is global and international. So looking at unique contexts across the globe to understand, okay, what are the unique considerations that might need to be taken into account in implementing, for example, strategies around resilience and creating a more resilient asset. What are the risks? So we really strive to create strategies that are applicable across a broad range. With the emergency preparedness planning, we kind of leave it to the user to tell us what are the areas of concern, and then we'll walk through, okay, these are the things you need to address when you're considering a specific emergency. And so, as I mentioned, really committed to the translation of peer-reviewed evidence and science into actionable solutions. I think in my work, sort of coming from the public health perspective, this is what really excited me about Fitwel and the Center for Active Design was this ability to create actionable solutions out of literature. A lot of times literature and evidence will kind of sit within the peer-reviewed journal and not be kind of touched or implemented. Whereas our kind of approach really makes it so that these strategies and tactics can be implemented within the real world, and really bringing that research to life and showing how different stakeholders can be involved in our work to kind of create a healthier society. And so what you see here is each scorecard has around 70 strategies that are targeting that unique context. For example, the strategies in a multifamily residential might be slightly different than the ones in workplace. And each of them touches on one of the categories here. So operations, design, performance, programming, and amenities. So operations might be something like indoor air quality policy. Design is around placement of stairs, making sure that there's access to natural daylight, views of nature. Performance is around indoor air quality testing or water quality testing to kind of audit the performance of a building. Programming, having health programming or events on site where you bring in the community to kind of foster that social interaction. And then amenities are sort of having a fitness facility on site or a quiet room. So areas that meet a broad range of needs amongst the population. And so I've already sort of touched on this, but really focused on providing actionable solutions that can guide our community of users and folks across that real estate sector towards how they can address their concerns and address the health needs of the occupants and really meet their goals as an asset. And we actually just released a new standard, and this new standard does a couple of things really well. One area is that it creates additional efficiencies for our users. So we have a very user-friendly tech platform where all of the certification processes and all of the kind of audit of the building happens. And I'm going to talk a little bit, I'll walk you through some of those areas in a little while later on this conversation. And this really is, we frequently hear feedback that this is a real boon for Fitwel because it makes the process engaging, it makes the process interactive, and it also helps our users go through this in a much more efficient way, which is great for us to see. And another area that I will mention is that with V3 and with all of our standards, we are committed to aligning with GRES. So V3 has been verified for points through GRES. So I know this is an area of focus for a lot of people in this moment as the platform is opening. And this is something that we continue to have a relationship with GRESB and work to ensure that we're in alignment with their certification guidance. And so this is just a little bit of additional information building on what I had talked about in the areas that our scorecards touch on. So with location, things like access to green space or walkable amenities or natural disaster risk. We in V3 really worked hard to bring in aspects of resilience, understanding that that is a core public health concern. And it's also a core concern that a lot of folks across the real estate sector and the built environment are grappling with right now. Where do we build? How do we build in these spaces as natural disasters become more frequent? So this is an area that we felt pretty passionately needed to be a part of our standard, and we integrated it as a part of the updated version. The updated version also integrates additional strategies around accessibility, and it also integrates additional pathways for many of our strategies. We see a lot of times in our certification process really innovative ways that folks are working to address the intention of a strategy. And that's something that with each version update, we want to honor these unique applications and make sure that they're represented in the standard. So that's something that we worked hard to integrate into the updated version. And so now I'm going to talk a little bit about the structure of Fitwel and how we connect Fitwel to not only health, but also economic impact. So as I mentioned, this standard's developed based off of building on hundreds of years of public health evidence connecting where our environment to health outcomes. And it was originally developed by the federal government. And what you see here are the 7 health impact categories that were identified as based off of a lit review at the time of more than 3,000 articles, and now our database supporting Fitwel is up to 7,000. So, but these 7 impact categories have rung true sort of throughout. And really what they represent are the unique ways that the strategies are impacting health and well-being. And one thing that's really notable about Fitwel is that with each strategy, our research team connects that strategy to the specific health outcomes that that intervention will impact, and also evaluates the evidence based off of the strength of that evidence. So how many articles are there, kind of making this connection, and then also the extent of that evidence. So how strong is the relationship that we're seeing within that. So that helps us to determine which strategies are going to have the greatest impact across the board. And increasingly, we've really been focused on how can the Fitwel strategies not only be shown to impact health and well-being, but also demonstrating that value from an economic perspective. That's something that we're seeing an increasing need for in the market. And what we found is that there is a relationship between many of the interventions and strategies and economic outcomes. And so we looked at, based off of a similar process of looking to the literature, what are the ways in which these strategies are really driving economic value? And what we found is that there were a couple of different themes that emerged, and those ranged from things like increasing ROI, so increasing rental rates that we sort of talked about and saw with the connection between certification and rental rates shown in the MIT study, and other areas such as increasing productivity or reducing costs, reducing risk exposure. So we know that increasingly those assets that are located in flood risk zones or fire risk zones are at risk of, rising insurance premiums. So what can we do to reduce that risk? And are there design elements that can be integrated and implemented to reduce that risk over time? And so this analysis is something that we've integrated into our platform, which is really exciting. That's a new attribute that we just added, is connecting each of the relevant strategies to the specific economic impact. So not every strategy has an evidence base that connects it to an economic outcome, but for the ones that do, we list out what that relationship is and provide some information, additional insight into where we see that connection. And I'm going to talk a little bit more about some examples of where we see those connections forming. So this next series of slides will sort of walk you through how we think about these relationships, and kind of taking from what the intervention is to what the health outcome is and to what the economic impact is, and walk you through a little bit of our thought process there. So one strategy that we integrated as a part of the V3 update is around mitigating the risk of heat island effect. We know that temperatures are rising. We know that there's a lot we can do on the ground in order to mitigate that rise and slow it. So things like adding in additional greenery, street trees, tree canopy, green roofs. We also know albedo pavement, reflective pavement. So lots of different design elements that can be integrated in order to cool the environment, because we really do see that in different neighborhoods in New York City. I think there's up to a 20 degree differential in different neighborhoods, depending on sort of the infrastructure that they have in place, whether or not there's a lot of pavement versus more trees within different neighborhoods. So we're seeing that sort of real time, and know that there's a lot we can do on the ground to mitigate that. And so you see here, green roofs can be up to 40 degrees colder than a conventional roof. Obviously, a roof that's a very a stark differential, because roofs are sort of where the heat hits first, and it can lower the surrounding temperatures by up to 5 degrees. So that is super significant and can make a real big difference. And reducing the heat island effect is essential for making sure that those who are vulnerable to higher temperatures aren't ending up in the hospital or experiencing heat-related illness, which we're seeing happen more frequently. Actually, heat is the natural kind of occurrence that is tied to the largest number of deaths, which is sort of surprising, because it's not a crisis point that we see in the same way that we might expect a flood or a fire to impact folks, but it's really having a very detrimental impact. And then taking from going from the health perspective to the economic perspective, we're seeing that trees are linked to a 7.2% decrease in average national residential energy use. And obviously, energy efficiency is a core way to cut costs. We know that that is one of the ways in which the energy efficiency movement has become so widespread. Is it really does have an economic value, and we see this interaction oftentimes between elements that are tied to sustainability and those that are tied to health, and where the overlap is in promoting both of those in tandem to create economic value. And so I'm going to dig a little bit into, now that we've sort of set the stage of what is Fitwel, what issues are we working to address, and how do we address them, by sharing a little bit more about the brass tacks of what are the products that we offer and how do you get started with them. So we offer two different pathways, and one is really focused on certifying an asset in a really robust and holistic way. So it digs deep, has around 70 strategies, and you're really looking at the asset across the board to understand what are the various ways in which it is promoting health, while the other one is more of an at-scale approach. So looking at a smaller subset of strategies and how they are addressed across a broad spectrum of assets within a portfolio. And we really see the two going together very well. Asset certification might be a really good fit for those Class A office buildings, or those Class A buildings that are going the extra mile and really taking a robust look at health and well-being, whereas scale certification and the scale approach might be a really compelling pathway if you want to audit and analyze your buildings across the board. So it's still offering a certification pathway, and we're still looking at each asset individually, but the smaller subset of strategies enables a kind of broader look at how the buildings are performing. And so to dig a little bit into the different pathways and scorecards, we offer building scorecards as well as site scorecards. Within the building scorecards, we offer workplace, retail, multifamily residential, senior housing, and student housing. And within the site scorecards, we have commercial and industrial and community. And just because you have an asset type that you don't see mentioned here, it doesn't mean that we can't address it. It just means that we will work with you to figure out what the best fit is. So I'm going to ask my colleague Janelle, whenever you get a chance, to drop in the applicability matrix, because that will be helpful in understanding where, if you do have asset type that falls outside of these, where the opportunities might lie. And so with the asset certification, we are really focused on market differentiation. So how can, by integrating health sort of holistically across an individual asset, how can that asset set itself apart and really highlight the ways in which it's meeting occupant demand? We know that occupants, whether they're employees or residents, are really looking for health promotion in a more holistic way nowadays. And how can the Fitwel certification really support your work to differentiate that asset within the marketplace? In addition, we see this as an opportunity to continue to meet regulatory standards. We look at things like accessibility, resilience, and as we see regulatory shifts, we work to address those. And in addition, we, as a part of sort of the effort to differentiate an asset, will work with your marketing teams to develop messaging and provide insight into how the attributes you're implementing and integrating can really be highlighted. So as a part of the Fitwel certification, we offer a gap analysis that sort of highlights the things that you're doing really well and what the rationale and what the impact is that you're having by implementing those initiatives and those interventions. And so, as you can see, sort of following a typical certification pathway here, alongside the certification, we provide access to a plaque, and the rating system for Fitwel is 1 to 3 stars. Once you get to 90 points, that's the threshold to get to 1 star. And that really provides a kind of certification and validation that you are doing a great job in promoting and supporting the health of those that occupy your space. And this is a 3-year certification, and we offer discounted recertification opportunities. So we really do want to see that continued use of the standard to oftentimes we see folks be able to boost their score from 1 star to 2 star when they recertify, as awareness of the standard expands. And here is just a glimpse at the pricing. If you want any of this information, as I mentioned, we'll share my contact information afterwards, and we can definitely provide that. And then this gets a little bit into the site certification. So as I mentioned, we also address community developments as well as workplace, commercial, and industrial spaces. So a similar process, but just applied to the outdoor areas instead of the interiors of the spaces. And so just to quickly walk you through the process for asset certification, these are kind of the milestones that we look for: register the building and then assess. And the assessment can be a self-assessment that you can do on our platform. And this is really going through the strategies to see, oh, am I effectively, do I have an effective integrated pest management policy or protocol, or do I provide access to daylight in these core spaces, or do I offer a fitness facility? So sort of that's the first step to be like, oh, is this building or is this asset a good fit for Fitwel? Then benchmark. So establish the baseline for assessment to meet improvements over time. So understand where you are now and where there might be an opportunity to improve. So as I mentioned, at this point, you'll have access to a gap analysis to understand where your asset is performing well and where there's opportunities for improvement. And we kind of see this as a tool to prioritize, essentially. And then documentation, if you want to move forward with the certification process, you'll document, you'll submit the documentation, and then you'll submit it to our third party, our Center for Active Design, to review that project and audit, and basically we'll provide comments and feedback where we need additional documentation. And then there will be a back and forth with our team to provide that documentation, and then we'll do a final review. And then get your certification, and down the line, plan for recertification. So that's really, these are sort of the milestones in the journey that we see a asset going through when it comes to asset certification. And now I'm going to talk a little bit about FSP, so this is Fitwel Scale Certification. And this is a newer product that's really focused on a portfolio-wide look at how your portfolio or entity is performing. So what this process really entails is we have subset of 50 or so strategies, 45, I think, that have been connected to value economic impacts. And those strategies enable a kind of way to look at your assets across the board and see how each of them is performing. And so some kind of core components that I want to highlight here are it applies to 100% of assets in a portfolio. There are no minimum requirements or thresholds for certification. So this pathway is really about understanding your assets. So understanding where they're performing well, where there's room for improvement, and where the differences are. So where can assets learn from one another? Oftentimes we see one asset performing really, really well and another performing more not quite as well in certain areas. Where are there opportunities to improve? And then the goal here is really to enhance long-term asset value. This is an annual certification that we see as an approach to continue to measure and benchmark your spaces. And one really exciting part of this approach is that it is accompanied with a performance report. So this report is really designed to compare your entity against Fitwel peer projects. So helping you to understand how you're performing against others that are within your sector. So if you have a portfolio of multifamily residential, then it would be compared against other multifamily residential projects. And this comes as a part of the signing on with Fitwel, the scale certification process. And so as you see here, this is really a scorecard that is evaluating across the board. How is each asset performing? And then how is the overall entity performing? So here you see that asset number 3 is doing a great job performing 88% of the strategies that are available. And there might be, room for improvement when it comes to asset 4. So I think what this does is really gives that holistic view of where the kind of variety of assets across your entity and where there might be opportunities for improvement, but then also just a way to better understand what's happening. So you see sort of some of the key areas that we address within FSP: creating resilience, engaging with occupants and community stakeholders, and promoting equity. And we also, as a part of this, address walking and active transportation, enhancing access to biophilia, and then supporting high quality environment. And again, these were determined based off of that overlap between the interventions and economic outcomes. And so, as with the others, just wanted to briefly share the entity value and pricing. So some of the value here is it really is a way to differentiate in the market that you're looking across your whole entity and working to understand where there are opportunities when it comes to health and well-being and how to integrate that into your entity. And it is also tied to GRESB. There are GRESB points associated with implementation of FSP because it is verified on that asset level. And it can, lead to differentiation in the market, reduce risk exposure, and help satisfy some of those investor expectations that we're seeing become more frequent within the marketplace. And so here I just want to share a little bit about what our platform looks like and how that can be utilized in that information. So as you see here, we have both the health impact categories as well as the economic impact categories. And these are really showing, okay, across your portfolio or your entity, this is where you're landing. So 100%, and this would be great, 100% of the strategies that are tied to increasing productivity are being implemented. And that's something that you can share with your community stakeholders of this is something that we're really focused on addressing, and we're doing a good job of it based off of sort of the information that's highlighted within the standard. And just another view there. And then if we get into the asset specific level, you can get a understanding of how that specific asset is performing. And so what you see here is all of the different, on the left-hand side, are all of the different sections. And within that, there are different strategies that are being adopted. And then this is just the platform as far as the process for uploading information, and then some additional resources here that we will share in the chat, just giving access to sort of a starter pack with additional information to take away today. And one additional resource that isn't mentioned on these slides, but that I did want to mention is we recently launched an updated version of our ambassador course, and the ambassador course is a really great way to get started with Fitwel. So it provides a great overview of not only the connection between health and the built environment, but also into the different pathways available with Fitwel, and sort of a little bit of a deeper dive into specific strategies and the content there. So would highly recommend, Janelle's going to share that in the chat as well. And that is a new refresh version that aligns with V3. It shares some more information about FSP as well. And that is a great starting point if you haven't already taken it. There are some promotions running right now too. And so before I close out, I just want to touch on some different ways to get involved. I already touched on the ambassador pathway. I think that's a great first step to kind of get a sense of what Fitwel is all about, kind of use everything you learned today, but then apply it, and you take a course. It's a certification. And then the other ways that are more company-wide are becoming a company champion or a champion provider. And these offer distinct pathways based off of your company type to apply Fitwel across the board and scale up your use. So champions that own, operate, occupy real estate and make a commitment to using Fitwel at scale are our champion companies. And then the champion providers are really architecture, design, engineering, property management, consulting firms that are working to share Fitwel with their clients and with the folks that they guide and provide consultation to. As I mentioned, ambassador program, we have more than 4,900. We're really close to that 5,000. Help us get there. And across cities globally, countries globally. So really, this is something that no matter where you are coming to us from today, this is a really great starting point educational platform. Champions representing a big, a huge amount of projects that they've submitted. They're really the leaders within this industry that are going the extra mile and really integrating Fitwel and health and well-being at scale. And then champion provider companies. So this is a newer program, but has been really successful thus far, and helping us to increase awareness and use of Fitwel across the board. And these are just an example of some of the companies that we work with. And with that, I am going to just look at the chat quickly and see if there are any questions that came through. And if you have any additional questions, please put them into the chat now, and I will take a moment to start to answer those. And also, I'm going to leave this up here. I think this is, the best slide to leave up, that provides some additional information about a discount and using Fitwel for your GRES score. So the first question is, how can we bring this into Saudi Arabian market? And what support service can we have from your side? So this is something I would love, Abdul, if you could follow up with me. Janelle's going to share my information via the chat. And we are already working in the Middle East, and we're working with Aldar and some other companies out there. And this is definitely a market that we're operating in. We're excited and enthusiastic to expand our work there. So definitely please reach out to me at my email is sarah@centerforactivedesign.org, which will be shared in the chat. And I appreciate you joining today. Thank you, Jessica. Yes, we can send some links afterwards to you. I know it's hard to be multitasking. And then Matthew, is there a hospitality/hotel pathway? So this is something that we are increasingly exploring. We've gotten increased interest from this market. So Matthew, I would love if you also were to reach out to me, and I can connect you to the right person to discuss your interest in what that pathway could look like. And the scorecards can be found on the Fitwel website. So it's fitwel.org under resources. And also a lot of the information can be found in our help center. So Janelle, if you could share a link to the Fitwel Help Center, that would be super helpful, because I think that would help guide some folks towards content that's super easily accessible. And also, thank you. They can also be found in our resource center. So everything can be downloaded for free when it comes to the scorecards and across the different contexts. So with that, if there aren't any more questions, I'm gonna pop my information I'll just pop my email here because I'm not sure if it's been shared yet. Oh, Janelle got me. Perfect. Thank you so much. And thank you guys all for joining my monologue today. I appreciate it. And I hope you have a great rest of your week. And hope to talk to you soon. Thanks.